Dr. Gupta, can you confirm that if vaccines are used properly, is the measles something that at this stage in time should be deadly in America? And secondly, what do you make of the HHS secretary saying that these things happen in scattered ways across the country, seeming to downplay it?
Well, good morning, Mika. Yeah, first of all, Joe's exactly right. One dose of the measles vaccine is part of our usual routine pediatric regimen, 93% effective at preventing measles. 2 doses, 97% effective. For all the parents out there, for your babies, they get them at year 1 and ideally at year 5. So that's the routine. Joe's exactly right. Exemption rates in places like Gaines County, Texas, to just emphasize this point, are now up to 18 to 20% in 2023, fully eradicated, we thought, in 2000. So that's the reality that we're dealing with. In terms of just fact-checking RFK, it's important to realize between the years 2020 and 2023, Mika, on average, we saw about anywhere from 50 to 100 cases in total in those years between 2020 and 2023. So no, this is not just business as usual. This is unusual. We've seen 124 cases and it's February 26th. So something unusual right now is happening. And let's just also put a finer point on it. His former organization that he just resigned from is actively putting out information as we speak this week, stating that somehow the vaccine itself, because quote unquote it's ineffective, to use their words, is the reason why this is happening in Texas, this outbreak, versus the low vaccine rate. So this is happening. His organization is putting out this information. I don't know a single credible doctor that you'd want caring for your family, Mika, or for your loved one, that believes or wants any of this.
Dr. Gupta, good morning. This obviously was settled science for a long time, viewed as one of the great miracles of the 20th century, along with the polio vaccine in 1955, this vaccine for measles in 1963. We've been using it as a country, as a world, for more than a half century. So what are your fears as a physician as this disinformation that's being pumped out from certain quarters really does make its way into the bloodstream of America?
You know, I mean, Willie, what's sad here is that this is not to be trifled with. Measles is an extremely serious viral illness. It spreads through respiratory droplets. So you and I used to talk about droplet spread all the time, peak COVID. But what does that mean? That means if somebody is infected, unvaccinated, they cough or sneeze, Willie, studies have shown 9 in 10 people around them, if they're also unvaccinated, will get infected. It's that contagious. So that's number one. It's very contagious. Number two, it is extremely serious. The Lubbock, Texas Pediatric Hospital, their spokesperson emphasized it. They said that there's 18 kids in ICU, or roughly almost 20. All of them in it, it appears, for respiratory issues, meaning that the complication that we worry about, pneumonia, is likely at play. So this is a very serious illness. 1 in 4 people unvaccinated, infected, end up in the hospital. So severe illness, whether it's pneumonia or brain swelling, otherwise known as encephalitis, very, very common. This is not uncommon. Extreme consequences are quite common.
Meanwhile, a vaccine advisory committee meeting to select strains of the flu to be included in the next season's flu shot has been canceled. A committee member says there was no explanation for the scrapped meeting, and a spokesperson for the Department of Health and Human Services, which oversees the FDA, did not immediately respond to a request for comment. It comes as the United States is in the midst of a particularly severe flu season already. The meetings are important because the virus changes year to year, and the vaccine must be updated to provide the best protection. And Dr. Gupta, that meeting is part of strategizing as to, what could be coming. What do you make of the abrupt cancellation, and does it give you pause in any way?
Well, Mika, what I would say is this is not common in presidential transitions. We didn't see this during the first Trump administration. We didn't see this in the George W. Bush administration, the Obama administration. It is not common to cancel these vaccine advisory meetings. Exactly to your point, your lead up was perfect. These are meant to plan ahead. There's a 6-month manufacturing cycle, Mika, for the flu vaccine. So there's a reason we schedule it in March, because 6 months down the road, turns out that's when we want to start getting our flu vaccines. And so the fact that we're not scheduling it By the way, a similar vaccine advisory committee meeting was canceled just this week for a different purpose. The question here is, are these going to be rescheduled? Are they going to be rescheduled quickly? Not clear. And again, there's a 6-month turnaround. So if we don't do this quickly, perhaps flu strains are not going to be incorporated or any new data into what we want to get immunized into people's arms come September of 2025.
Mike.
Doctor, can you speak to the elements of a virus and how quickly those elements can change based upon the cancellation of this meeting that they were supposed to have? How quickly do the elements of a virus change or could change?
Oh, Mike, we're seeing this with bird flu play out as we speak. It can happen in a matter of weeks, where we saw in the case of, again, avian flu, that strain changed within a matter of weeks in terms of what we were seeing in human beings. There was actually a very sick teenager in British Columbia in which the virus was changing quite literally before our eyes. And so this is something that can be instantaneous. And that's why predicting what needs to be in the 2025 flu vaccine is so important. It's an imperfect science. Let's be clear. It's an imperfect science. Nothing is ever perfect. But even if we're 50% correct, that mitigates the risk of severe illness by 50%. That's a big deal.
Yeah.
NBC News medical contributor Dr. Vin Gupta, we always appreciate you bringing the facts, the truth about medicine to us. We'll be talking to you much more.